Hello, everyone. Today we are talking to Christina Miller, and she is the administrator for the Office of Public Health in Montgomery County, Pennsylvania. And she is here today to discuss with us vaccination mandates. Welcome, Christina. Thank you so much for joining us.
Thank you for having me.
Well, why don't you start by telling us a little bit about yourself and your background?
Sure, absolutely. So I actually come to public health with a little bit of a winding path behind me. I actually, my undergraduate degree is actually in business management, and I knew right from the get-go, and while I was doing my undergraduate degree, that I really wanted to do something in the space of social services or human services, and so I talked with my advisor while I was in my doing my undergraduate program, and he suggested that I stay in the business school because, in his words, nonprofits need folks with a business perspective as well, and that seemed like really good advice. But that said, my first job out of university was doing home visitation work with families that were known to the Department of Health and Human Services for any number of reasons, and working alongside of them to help them access resources and support their families. And I think through that process, through that experience, I learned quite a bit about Philadelphia, about navigating complex structures. And that really pushed me in the direction of pursuing a social work degree as a follow-up. And I knew that I wasn't sort of situated towards clinical service. What I really had an eye for and sort of a perspective for was structures and systems and policy, and how that impacts us as individuals, how that impacts us as families and communities. And so my social work degree is actually in policy and advocacy. So subsequent to doing that home visitation work, I managed an anti-human trafficking program, worked in philanthropy for a little while, and after that then came to public health. And I think that's where for me, I found my professional home. Mm-hmm. I came in with that perspective of the systems and structures, that ecosystem around us, and how that shapes our day-to-day life, how that shapes our health. And that's what I brought with me into public health. So with that, I spent about 11 years at Public Health Management Corporation, which is the Public Health Institute for Pennsylvania. And alongside of that, one of its subsidiary organizations called Health Promotion Council.
Mm-hmm. Wow, that's fantastic. Thank you for sharing all that with us, because, I love that you are mentioning the concept of systems, right? Mm-hmm. Because especially recently, we in the public consciousness, we've really been talking about maybe broken systems and how, things systemically are not working out for the everyday person, for everyone. And it's really fantastic that somebody with that mindset is in the position that you're in. So that's really fantastic. Can you tell me a little bit about your position as the administrator for the Office of Public Health?
Yeah, absolutely. So again, I come into public service having close to 20 years of nonprofit and philanthropic experience behind me, and so I come in with a different sort of perspective, one that is grounded in community-driven programming, community-based programming, and where I'm often in that mindset of co-creating along with the communities that we're working with. And so I bring that perspective into my role as administrator for Office of Public Health with Montgomery County now. And in particular, my responsibility here, and mind you, this is during times of COVID, is broad strategic leadership and oversight for multiple departments within the Office of Public Health. That includes things like water quality management, environmental health services, that includes communicable disease prevention and control. That also includes our clinical services and our public health emergency preparedness. So it's really providing leadership, broad oversight for all of those departments, but keeping in mind that there is deep expertise, deep technical expertise within each and every one of those departments. So I see my role largely in the context of that team as really harmonizing the work, across all of those departments, providing that strategic leadership alongside of our county leadership, and really, building and strengthening our work in partnership with community.
Okay. Very interesting. Thank you. And so today we're only going to dive into one part of that huge
Yep,
picture that
absolutely.
you're so responsible for. So let's talk a little bit today about. Can you tell us what is Montgomery County's current position as it relates to vaccination mandates? And we'll talk about it in two parts. Let's talk about it first in regards to the county resident, individuals who are just living in and residing in the county. And then I want to talk about it in regards to county employees, people who actually receive a paycheck from the county. So let's start by addressing the position on county residents.
Absolutely. So we, as a county, do not require county residents to stay up to date on their vaccinations for COVID in particular. However, that said, we do within the county for individuals, as you stated, for individuals receiving a paycheck from the county, those who are employed by the county, they are either vaccinated or they are participating in COVID testing on a weekly basis.
Okay, perfect. And obviously COVID is the major topic of discussion right now, but is that would similar statement be made for other types of vaccinations? Like, for example, is there any vaccine that's required for county residents?
So only the vaccines that would be required for individuals for school
Right.
purposes,
Okay,
right?
gotcha. Hmm.
Right. And so in the Commonwealth of Pennsylvania, that is actually a legislative process. Approval of those vaccinations for schools or school mandates is a legislative process. So not something that I, as a county administrator, could impose on residents as it is. Certainly, and 100%, we encourage all of those who are eligible to stay up to date on their vaccinations, whether that is for COVID or otherwise. And we make all tools available and accessible for individuals who want to stay up to date on their vaccinations.
Perfect. And can you walk me through a little bit what the process would be at the county level that everyone engaged in order to arrive at the position? So, for example, how did you arrive at the position that, you had mentioned that it's a legislative role on the state level to require vaccines in the state of Pennsylvania. So that might have been pretty cut and dry for county residents. But I'm curious, how did you arrive, as a team on the idea that county employees should receive this vaccination?
Right. So first and foremost, our recommendations and requirements are grounded in science and data. So we follow the CDC and the Pennsylvania Department of Health, and in terms of our recommendations. And beyond that, a lot of that process was really collaboration and coordination, communication with state, local, and federal health officials, right? And in concert with our county leadership, our solicitor, and a review of essentially the beyond the science, beyond the data, what the landscape is in terms of public health and vaccination requirements for employers, right? So currently, as we're doing this interview, there's a lot in the news right now around vaccination requirements. Currently being heard by the Supreme Court. So in terms of making that decision, in large part, we're starting with the science. We're doing a landscape assessment. We're in conversation with our counterparts at the state and federal levels, and then beyond that, reviewing what is the legal landscape and what is our legal ability to require this in the context of our employees.
Okay, so why don't we dive into that a little bit more? Can you tell me a little bit about what legal considerations and conversations happened around this topic to help the county arrive at this decision?
Sure. Well, let me take a little bit of a step back and give sort of a primer here. So, in terms of public health action and public health decision making, first and foremost, we are guided and our decisions are grounded in science and the evidence, right? But beyond that, there are factors for us to consider at not just the federal level, but the state and county level as well. So, we also look to, in Pennsylvania, the disease prevention and control law. So this is the public health law for Pennsylvania, which guides what is and isn't possible. It guides our activities and our actions as public health officials and as public health departments across the county, as well as the state's Department of Public Health. It guides their activities as well. And at the more local level, we have a county public health code, which really kind of solidifies and guides not only our work, but also the actions that we are able to take, for example, in response to a pandemic. Within that, even I, as the administrator, my role really is the oversight and the sort of day-to-day operations of the department. And I, in addition to our county leadership, have the benefit of a board of health, a 5-member board of health that is responsible for governance and decision making when it comes to public health. The work that we do. So again, like it's a multi-layered sort of system, just on the public health side. And then beyond that, in terms of making a decision about a vaccine requirement or mandate, you know, for our employees, for county employees, we're then looking within the county leadership structure and the county solicitor and the county solicitor's office. And so that individual and their team is in a position of doing that legal review for us. What is this decision grounded in? Do we have legal standing to make this decision or to enact this policy? And that could involve things like case review, for example. And so right now, in terms of vaccine requirements, certainly there's quite a bit of case law under consideration right now in terms of whether and where vaccine requirements can be enacted. So there's more to come on that, but just wanted to give you sort of a sense for the ecosystem that is influencing our decision making.
Yeah, absolutely. And what you're really sort of telling me is that it's multi-level. You know, we're looking at every area of law, legislative, health codes, case law, and you're really doing the due diligence necessary to determine what the county can do and where the boundaries might be.
Exactly.
Fantastic. Well, thank you so much. That was really helpful and very informative. And thank you so much for taking the time to discuss this very important topic with us today. Faculty and students who are interested in additional resources or course materials related to this topic, you can find them on the webpage where they downloaded this video. And thank you again, Christina Miller, for your time.
Thank you for inviting me.